Hi everyone. Today we're going to tackle about gonadal hormones and its inhibitors. Ovarian hormones. What is ovarian hormones? The ovary is the primary source of our gonadal hormones in women during the childbearing years between puberty and menopause. When properly regulated by the follicle stimulating hormone or your FSH and luteinizing hormone or your LH from the pituitary, each menstrual cycle consists of the following events. Meron ding a follicle and the ovary matures, secretes increasing amounts of estrogen, releases an ovum, and is transformed into a progesterone secreting corpus luteum. If the ovum is not fertilized and implanted, the corpus luteum degenerates. The uterine endometrium, which has proliferated under the stimulation of the estrogen and progesterone, is shed as part of the menstrual flow and the cycle repeats. Ito yung process ng menstrual cycle. Pero later, I'll explain to you the mechanism of action of the estrogen and progesterone. So, moving on to the mechanism of action. So, the action of both estrogen and progesterone involves entry into cells, binding to systolic receptors, and translocation of the receptor hormone dimer into the nucleus, where modulates gene expression. So here, the hypothalamus is from the brain. So for the mechanism of action of estrogen and progesterone, it is under control of your hormones secreted by your pituitary gland and ovary. Of course, the pituitary gland. Your hypothalamus naman, itong sa taas, controls your pituitary gland. And then, yung hypothalamus mo will release a hormone called the gonadotropin releasing hormone or the GnRH. And then after that, yung GnRH mo mag-stimulate siya or stimulates the anterior lobe of pituitary to secrete your follicle stimulating hormone. And after that, your follicle stimulating hormone travels in the bloodstream to the ovaries and stimulates a group of follicles to grow. So, meron tayong primary and secondary follicles. This will then produce the hormone named estrogen. Sa primary, ito yung estrogen. And then, ang estrogen mo naman will increase its hormones and will act back into the pituitary to induce more gonadotropin releasing hormone or GnRH. And then, pagkatapos nun, ang GnRH mo, nagbalik siya sa cycle, di ba? Kasi kanina, nung umpisa, nag-produce ang hypothalamus mo sa pituitary nag-produce ng GnRH. And then, pagkatapos na mag-produce ng estrogen, babalik siya ulit doon sa pituitary to produce more GnRH to produce another hormone which is called luteinizing hormone. Yan siya. Moving on with estrogen. So, estradiol is the major ovarian estrogen in women. So, ang mechanism of action of estradiol is that in your body, it binds into your estrogen through the lock and key method. After niya mag-bind doon, ang natural formation ng iyong estrogen ay mag-change into new transformation. And then, it will attach into your DNA, in your DNA sequence, para ma-activate yung gene mo or ma-modulate yung gene expression mo. Yun siya ang ginagawa ng estradiol sa inyong body. It has low oral bioavailability but is available in a micronized form for oral use. It can also be administered via transdermal patch, vaginal, cream, or intramuscular injection. For effects, Estrogen is essential for normal female reproductive development, of course, sa mga babae na hindi maka-produce ng estrogen sa body. It is responsible for the growth of the genital structures, such as vagina, uterus, and uterine tubes, during childhood and for the appearance of secondary sexual characteristics and the growth spurt associated with puberty. Estrogen has many metabolic effects, such as it modifies serum protein levels and reduces bone resorption. It also enhances the coagulability of blood and increases plasma triglyceride levels while reducing the low density lipoprotein cholesterol and increasing the high density lipoprotein cholesterol. So note that kapag continuous yung pag-administer mo ng estrogen, asa kapag hinaluan mo siya ng another progestin or other estrogen, it will prevent the secretion of gonadotropins from the anterior pituitary. So, dapat ang pag-administer mo ng estrogen is limit lang. That's why we have to consult our doctor or physician first at huwag tayong assume na alam natin ang lahat at alam natin kung paano i-take ang isang gamot. For its clinical use, estrogens are used in treatment of hypogonadism in young female. Another use is the hormone replacement therapy in women with estrogen deficiency resulting from premature ovarian failure, menopause, or surgical removal of the ovaries. HRT ameliorates hot flushes and atrophic changes in the urogenital tract. It is also effective in preventing bone loss and osteoporosis. The estrogens are components of hormonal contraceptives. For toxicity naman, in hypogonadal girls, the dosage of estrogen must be adjusted carefully to prevent premature closure of the epiphysis of the long bones and short stature. When used as HRT, estrogen increases the risk of your endometrial cancer. This effect is prevented by combining the estrogen with a progestin. Estrogen used by postmenopausal women is associated with a small increase in the risk of breast cancer and cardiovascular events or myocardial infarction or stroke. Kasi 'di ba mostly sa estrogen, yung ano talaga is yung breast of the woman and their uterus. Pag dose-dependent toxicity includes nausea, breast tenderness, increased risk of migraine or headache, thromboembolic events, and gallbladder diseases. Moving on to progestins. So, progesterone is the major progestin in humans. A micronized form is used orally for HRT, and progesterone-containing vaginal creams are also available. Synthetic progestin have improved oral bioavailability. The 19-nortestosterone compounds differ primarily in their degree of androgenic effects. Kapag older drugs naman, ang ginagamit, example is L-norgestrel and norethindrone, they are more androgenic. They are more androgenic than the newer progestins such as the norgestimate and desogestrel. For effects of the progestin naman, they induces the secretory changes in the endometrium and is required for the maintenance of the pregnancy. So, very important in pregnancy. The other progestins named above also stabilize the endometrium but do not support pregnancy. Progestins do not significantly affect plasma proteins, but they do affect carbohydrate metabolisms and stimulate the deposition of fat. Well, in terms of estrogen naman, nag-affect sila or meron silang effect sa protein receptors in your body. High doses suppress gonadotropin secretion and often cause anovulation in women. So, kapag high ang dose, pag sobra-sobra, masama din. In terms of clinical use, progestins are used as contraceptives, either alone or in combination with an estrogen. They are used in combination with an estrogen in the HRT to prevent estrogen-induced endometrial cancer. Through this, combination may increase the risk of breast cancer.